Let's talk about what you can expect from a hospice time of death visit. First, it's important to understand that an anticipated death of a person on hospice is not an emergency. So when they die, you're going to call the hospice agency. You're not going to call 911. Now, it might take a while for somebody to get out to you because, again, death is not an emergency, and the hospice nurses are always going to prioritize living patients, especially at night when they might be short-staffed. They will get there soon enough. In the meantime, try to relax and be with your person. This is the last time you're going to be with them in their natural state after they've died. Now, if you live in a state where death pronouncement by a nurse is required by law, a nurse will have to come out. If you live in a state where that's not required, then you don't have to have anybody come out if you don't want to, and the time of death that goes on the death certificate will be the time that you tell us that your person died. The nurse might bathe your person if they need it, and if you want to participate in that, make sure you let them know if they didn't ask you. Some people like to be a part of that as a little ritual to get their person cleaned up before they send them on their way. Any medical devices will be removed, such as implanted ports or catheters, and they will instruct you or assist you in medication wasting. One thing you can expect them not to do is to pull a sheet up over your person's head. I have never seen this done by a hospice person in my life. It is a natural death, so it's not traumatic, and in hospice we are death positive, so we aren't going to try to cover them up and hide them away with a sheet like some kind of dirty secret. Hospice will notify the doctor and the coroner if that's required in your area, and they will call the funeral home when you're ready for your person to be picked up. That's something else you might have to wait a little while for, so you just have to kind of chill and be patient and take that time to try to process your grief while you're waiting. Now, I recommend that you take the jewelry off of your person before you send them with the funeral home. Not because I think that anybody's going to steal it, but because things can get lost in the shuffle, especially rings, because after a person dies, their fluids are going to shift around, rings can become loose and fall off the finger. Even if you want that jewelry to go with your person to be buried or cremated, it's always better to take it and then deliver it later. Also, some people have a change of heart and wish they would have kept that jewelry, but it's too late because it's been burned up in the crematorium. Now, that's kind of a general, typical time of death visit, but as always, hospice agencies can vary in what they will and won't do, so you want to make sure that you talk with your hospice team before the death occurs so you know what to expect and how to plan for it.